Good afternoon. Today's lecture is a short lecture dealing specifically with vaccines and vaccine development. So what I usually like to do when I begin discussing vaccines is go back to some concepts that we talked about way back at the beginning of the semester. When we introduced some of the concepts the very first day of lecture, the first definition I provided you was the term immunity. Immunity is, in fact, a state of protection from an infectious disease. And historically, there were plenty of examples that we had discussed where this immunity seemed to be taking place. For example, the Greek historian Thucydides described what was known as an Athenian plague. Now, in this particular case, what he found was that individuals, or what he documented, was that individuals who recovered from this particular plague, basically they didn't die, would be able to nurse the sick and not get sick again. And so this was something that was very interesting and again was sort of one of the first documentations of that phenomenon. If we jump just ahead a little bit, we have examples in the Chinese literature where there were attempts to induce immunity overall. Now, smallpox has been a disease that was causing lots of problems worldwide for many, many, many years. It does cause diarrhea, fatigue, fever, rash, vomiting, and happens to be due to a viral pathogen. What was noted in the Chinese literature was a variolation technique. This particular technique took dried crust from the pox of the pustule of a pox, and that dried crust was either inhaled or inserted into a cut of a healthy individual and would then prevent disease, meaning the individuals wouldn't get full-blown smallpox. Wasn't clear quite how this was working, but this was definitely something that was noted. In 1718, we have the work, or we should say the documentation, of Mary Wortley Montagu. She was the wife of a British ambassador to Turkey, and she witnessed this variolation technique being used by the Turkish people to protect individuals from getting smallpox. And this was the first documentation of Western examples of individuals having been treated with this technique. Basically, she had her children treated with the variolation technique in hopes of preventing them from getting smallpox. We also have examples a little bit later from the work of Edward Jenner. Edward Jenner was a physician, and he observed that milkmaids, again, ladies or young women that were milking cows, could catch a disease known as cowpox. Now, cowpox is a more mild disease, however, it is related to smallpox. And it turns out that individuals, milkmaids that had cowpox, were immune to smallpox. And this was really interesting to him overall. The very first test that he did was to use the variolation technique and inoculate a boy with cowpox. He then later went on to infect the boy with smallpox and found that the child was in fact immune. We also have the work of Louis Pasteur, who also played a role in our understanding of induced immunity. Now, some of his early work started with studying cholera, which is an infection of the small intestine, causes diarrhea and extreme vomiting, and is caused by a bacterial pathogen. What he did in a series of experiments was to grow bacteria, inject chickens in this particular case, and found that the chickens would in fact die or succumb to this particular bacterial pathogenic disease. What he did then was take what is referred to as an old culture, so a culture of the bacteria that had been sitting around for quite a while, and infected chickens with that. What he found was that the chickens would get sick, but they would stay alive and not die in comparison to what we would consider a fresh culture of the bacterium. He then took the chickens that were remained alive after this treatment, and he treated them with a fresh culture of the bacterium that caused cholera. And it turns out that these chickens that had survived the initial infection with the weaker, older strain also now were able to survive an infection with the newer, fresher strain. And so what he proposed was something known as the attenuation hypothesis. He proposed that this aging, weakened culture had much lower virulence, meaning a much lower degree in the ability to cause disease. And it was this weakened strain that could be injected into an organism, in his example, the chickens, and could protect the chickens from full-blown disease. So the term attenuate really just means to weaken. Also, interestingly, this is where some of our nomenclature comes into play, in that the weakened strain, the attenuated strain, he referred to as a vaccine. A vaccine, the terminology comes from the word vacca, which is Latin for cow, and this was a tribute back to Edward Jenner's work with the cowpox and the smallpox example. So our current terminology for vaccine is actually giving credit to some of the earlier scientists who help us understand how vaccines do in fact work. Now, Pasteur went on to continue to test his hypothesis by vaccinating sheep with an attenuated form of the bacterium known as Bacillus anthracis, which causes anthrax. He then took these sheep and challenged them with the new, fresher, virulent form of the anthrax bacterium, and found, in fact, that the sheep were immune to the more virulent form of anthrax had they been treated or vaccinated with an attenuated form previously. And this is really the birth then of our understanding of vaccine development, and how vaccines work. Lastly, on this slide, we do have an example, the first human example, where an individual, a young boy, was given a rabies vaccine. At that point in time, it still wasn't clear how it worked, but it did in fact allow the boy to survive. Okay, at this point, I always like to stress some definitions to make sure that we really truly understand the difference between these two terms. They are oftentimes used interchangeably, and they shouldn't be used interchangeably, and I'll explain why in just a minute. So an immunization is the process of producing a state of immunity in a subject. So this is a process that occurs. It's what's happening in an individual, regardless of the way it is taking place. So it is a way of producing a state of immunity in an individual. The second term on here is vaccination. Vaccination is the intentional administration of a harmless or less harmful form of a pathogen to induce a specific immune response that basically is going to protect the individual against a later or subsequent exposure to that pathogen. So a vaccination is a method of administration. A vaccination is a way to provide immunization, but immunization is not always by vaccination. Like those previous examples we just talked about on the first two slides, previous exposure to either a less virulent form or even a virulent form allowed for immunization to take place. So again, immunization is a process. It's what's happening in the individual. It could be to an exposure to a pathogen, or it can be due to exposure of a pathogen such as a vaccination. So hopefully that is clarified for you in the differentiation between those two terms. There are, in fact, two different categories of immunity that we can discuss. The first one is what's referred to as passive immunity. Passive immunity is basically immunity that's conferred by the transfer of immune products, such as antibodies or sensitized T cells, from an immune individual to a non-immune one. So passive just means you are being given something that allows for an immune response to take place. Oftentimes, in most cases, it is antibodies being transferred from one individual to another. Passive immunity can occur in a number of different ways. For example, maternally, antibodies can in fact be passed from the mother to her developing child or the unborn child, as well as antibodies can be passed from mother's milk to an infant or newly born child. So it is the passage of these antibodies from mother to child, whether it is in utero or after the child is born, is considered a passive immunization process. In addition, there are some vaccines that are available that are basically considered antibodies to a specific toxin or component in an individual. So in this table, you can see a number of diseases or disorders that can take place, and there are vaccines that are available to bind to those toxins to help prevent an individual from dying or succumbing to that particular component. So for example, snake bites, which is really common here in Kern County, for example, is that we do have vaccines that are administered at the time of a snake bite so that the venom can be bound up by the antibody and removed from the host system overall. Now, my goal in the next day or two is to put together a few bits of information dealing with our current situation and coronavirus vaccines. Some of the things that I have read are this type of vaccination process, basically taking antibodies from an individual who has had COVID-19 and their body does in fact produce antibodies, and taking those antibodies and then using them to treat an individual who is currently sick with COVID-19. But I will find some more information on that and pull together a little more detail. But there are some examples of current efforts utilizing this type of vaccine. The second category of immunity, dealing specifically with vaccines, is active immunity. Active immunity is an adaptive immunity that occurs or is induced by a natural exposure to a pathogen or a vaccination. So if you had chickenpox as a child, what happens is you become immune to chickenpox, and we know what's happening because of all of the things we discussed specifically with the adaptive immune response. Once you have encountered a pathogen, your immune system recognizes that, and hopefully, if your immune system is functioning properly, you get those memory cells, those memory B cells, and those memory T cells that lay in waiting for the next or subsequent exposure to that specific pathogen. So, active immunity involves the production of antibodies, specifically memory cells, both B cells and T cells, so that your immune system can recognize these pathogens again when you encounter them another time, and your immune system can then fight them off readily. So that's the natural infection and how immunity can in fact take place. However, we know that there are other ways for immunity to occur, and that is with a vaccine. So with a vaccine, you have the intentional administration of either a weakened form of a pathogen or a component of a pathogen that your immune system can then in fact recognize, interact with, and hopefully, if the vaccine is successful, build up those memory B cells and memory T cells so that upon a subsequent exposure to that particular pathogen, the full-blown pathogen, your immune system is ready to go to fight off that pathogen. And the table in this particular slide is really just highlighting the childhood immunization schedule that is recommended in the United States for specific diseases and disorders. Now, with our current situation with the coronavirus, There are also some examples, clinical trials that are actually being undertaken at this particular point to administer this type of vaccine, where a component is injected into the individual and hopes that their B cells and T cells will recognize that component and then be able to fight off an infection later on down the road when the individual is encountered or encounters this particular pathogen. So this too is an active area of research for the coronavirus currently. But as I mentioned with the previous slide, I will put together a little bit more information, maybe some reading material that you can go back and look on of our current situation. Now, designing vaccines